Okay, so we are discussing pulmonary embolism. So let's go into the clinical presentation. So we have classified pulmonary embolism into three depending upon the size of embolism, that is massive embolism, pulmonary infarction and pulmonary hypertension. So first of all, about the features of acute massive pulmonary embolism. In this condition, more than 50% of the cross-section area of the pulmonary arterial tree is occluded or completely blocked. And the precipitating factors of acute massive pulmonary embolism include straining at stool, out of bed after long rest, then rising from wheelchair, then paroxysms of cough, etc. These are the immediate trigger factors. Then other features like symptoms of circulatory collapse due to sudden reduction in cerebral and coronary blood flow, from obstruction to right ventricle outflow. That's the main feature. That is, symptoms of circulatory collapse is there and is due to sudden reduction in cerebral and coronary blood flow, from obstruction to right ventricular outflow tract. That's the main feature. And there will be dyspnea, which is sudden in onset. It's very brisk. Then tachypnea is there, hyperventilation. Then chest pain is an important symptom. Then retrosternal pain like angina pectoris or myocardial infarction. It mimics myocardial infarction. There is precordial chest pain. Then pain due to pleurisy may arise after a few hours or even after days. Then there can be hemoptysis. Then patient with massive embolism may be comfortable by lying flat and is unlike other causes of cardiac asthma. Usually in cardiac asthma, the patient will have difficulty in lying down, but in case of pulmonary embolism, patient is comfortable on lying flat. That's a differentiating point of pulmonary embolism, massive embolism. Then we can say or mark the symptoms into 4S. 4 important symptoms. So it's called 4S. And let's see what are 4S. First of all, sudden onset of respiratory distress, then severe chest pain, then syncope and shock. These are the 4S of massive pulmonary embolism. In some textbook there is represented as triad also. Triad, in that severe chest pain, syncope and shock. Triad item, or we can say 4S also. That is sudden onset of respiratory distress, severe chest pain, syncope and shock. That's 4S. Then about the signs of acute massive pulmonary embolism. First of all, due to diminished cardiac output, the signs include sinus tachycardia, then hypotension, shock and low urine volume. So when the cardiac output comes down, there can be sinus tachycardia, hypotension, shock and low urine flow. These are the important features of diminished cardiac output. So that's the first sign. Then signs due to pulmonary hypertension and right ventricular failure. Pulmonary hypertension, right ventricular failure. And these include raised JVP or raised jugular venous pulse, then hepatic enlargement, then right ventricular gallop rhythm, then pulmonary component of second sound is accentuated. Second sound means two sounds are there, hard sounds are there, S1 and S2. S1 is due to closure of AV valve, S2 is due to closure of semilunar valves. So in case of pulmonary embolism, or when there is right ventricular failure, the second component or the pulmonary component of second sound is accentuated. Then you can see here systolic murmur also in the pulmonary area. That's another feature. You can hear murmurs, systolic murmurs in the pulmonary area. These are the signs due to pulmonary hypertension and right ventricular failure. Then signs due to disturbance of pulmonary ventilation and perfusion. Signs due to disturbance of pulmonary ventilation and perfusion. That is the main sign is cyanosis. Cyanosis, gradually developing cyanosis. That's the main feature of pulmonary occlusion. Then signs due to pulmonary infarction, and it usually occurs 12 to 24 hours after the incident. And when there is infarction, there will be fever, pleurisy, symptoms of pleurisy, signs of consolidation, oscillatory findings like crackles and wheezes, all will be there. So these are the signs of pulmonary infarction. Then about the features of symptomatology in small or medium-sized emboli or submersive pulmonary embolism. Here the main feature is pleuritic chest pain. Pleuritic chest pain, then breathlessness is an important symptom. In 50% of cases there will be hemoptysis. Another feature is fever. There can be fever in pulmonary infarction. Then X-ray features are similar to pneumonia. Then typical findings of infarction that we have discussed earlier, that is triangular shaped opacity in X-ray. All these are features of small or medium-sized emboli or submersive pulmonary embolism leading to pulmonary infarction. Then features of multiple microemboli or chronic thromboembolic pulmonary hypertension. This is due to microemboli obstructing pulmonary vasculature. And the clinical picture resembles primary pulmonary hypertension, similar to primary pulmonary hypertension. And the pulmonary arterial pressure will be elevated. Isotope scans and right heart catheterization help to determine the extent and severity of the lesions. Then ECG help to demonstrate the degree of enlargement and hypertrophy of right side of the heart. Then echocardiography is also useful. It helps to estimate pulmonary arterial pressure. So these are the symptoms and signs you get in the three different types of embolism. That is massive embolism, medium-sized emboli or submassive embolism leading to pulmonary infarction, and microembolism leading to pulmonary hypertension. Okay.